autistic individuals are reported to have higher rates of healthcare service use. However, despite higher usage rates, autistic individuals and their families are more likely to report lower satisfaction with the care that they receive. Currently, there is no definitive set of best practice standards in providing care for autistic patients, which can be useful in the development and evaluation of efforts to improve care. This study aims to identify the components of what would make a healthcare practice autism friendly, according to a group of stakeholders, including primarily professionals whose interests include autism. It is a part of a larger autism friendly initiative at Boston Medical Center, which aims to improve the healthcare experience of autistic patients and their families. We conducted a modified 3-round Delphi study. A list of statements about possible components of an autism-friendly healthcare practice were compiled using insights from a steering committee, which consists of researchers, clinicians, hospital staff, and parents of autistic individuals. These statements were entered into an electronic survey, which was distributed to selected members of our professional networks and a mailing list of patients and families. In rounds 1 and 2, participants were asked to score statements from a scale of 1 to 9 in terms of their importance as a component of autism-friendly healthcare, 1 being not important at all and 9 being very important. Participants were also asked to indicate whether they were an autistic individual, a family member of an autistic individual, or a professional whose interests include autism. In round 1, participants could choose more than one groups. Therefore, score comparisons between groups could not be made, and thus scores were not used to eliminate statements. However, participants had the opportunity to add new statements if there were other components of an autism-friendly healthcare practice that were not represented in the original list. Newly added statements were integrated with the existing statements from round 1. In round 2, participants were asked to indicate the stakeholder group that best represented their perspective when answering the survey. Scores were analyzed, and statements that were scored lowly by all stakeholder groups were eliminated. Moreover, participants had the opportunity to rescue eliminated statements for the final round. Rescued statements that received more than 3 votes were included in the final list. In round 3, participants were asked to rank statements from most important to least important. In round 1, 78 participants scored 37 statements from a scale of 1 to 9. After integration of newly suggested statements, 21 statements were presented in the second round and scored by 51 participants. In round 3, 38 participants responded to the final round of the survey, which consisted of 16 statements. Topics that emerged from the 10 highest ranked statements include patient advocacy for autistic individuals, staff training to support autistic patients, and environmental or operational modifications to accommodate the needs of autistic patients. More research is needed to explore avenues to implement autism-friendly efforts, as well as the differences in perspectives of professionals, autistic individuals, and family members about autism-friendly healthcare practice. Thank you.